Vaccines are a very critical tool in this fight against COVID-19, but unfortunately in our country, we see that the women are lagging behind. When we talk about the men-women ratio, there's a difference about nearly 3 crore. So why is this so? I mean, is it because there are misconceptions, rumors, vaccine hesitancy? So to talk about all this, we have a special guest with us, expert Dr. Suneela Garg. She's going to be talking to us about COVID vaccination and its impact on women. She's member Lancet Commission COVID India Task Force. She's also the director and professor Community Medicine, Maulana Azad Medical College, and also the president of OMAG and IAPSM. Thank you so much, Dr. Suneela Garg, for joining us today. The first thing which I want to ask you is that, we just said that the women are lagging in the vaccination drive. Why do we see this trend? Why such a big difference? And is it more in the rural part of our country?
Ambika, your question is very valid, but I will take you back. Empowerment of women has never been a priority, number one, in our country. Number two, if you look at NFHS data 5, which has been released, in December 2020, 60% of the women never used, internet in different states. So, and, 20% of the women are having smartphones. So that is the extent of empowerment. And to go to the facility, to get the treatment or to get the vaccination, they're so much dependent on their family members. So that is one thing which is very, very important. And that's how the women lag behind, basically as compared to men, because they have never been empowered, and gradually the change is happening, but it will take time.
Okay, so another thing which is it, we've been reading a lot of stuff. There are a lot of myths and misconceptions, like, a vaccine could cause infertility, disrupts the menstrual cycle. So do you think this hesitancy for women to actually take the vaccine is also somewhere it's got to do with these rumors which have been going?
Definitely. This is not only with regard to the women themselves that they do have hesitancy. It's the families themselves. Who decides for women? It's their mother-in-laws. It's their, family, which family also will say, that, okay, if you're going to go for vaccination, maybe, you may suffer from infertility. You must first complete your reproductive cycle, or you may suffer from menstrual disorders. What is the, use of taking the vaccine? You are apparently healthy. So, as I told you, always, Ambika, women's health has never been a priority, kind of. And this has been true with regard to her reproductive choices also now. And the same thing is being applicable with regard to when we talk of COVID-19 vaccination, because apparently, if you see, she appears to be healthy. So that's what the family says, particularly. And this is where the difference comes, with regard to men and women, or with regard to a male child versus a female child. Of course, we don't have vaccines. Gender perspective looms at large in our society. So that's where we need to, kind of address this issue right now in different situations. We have got very good communication material, but it has to reach down, to the lowest level, so that last mile woman benefits from this.
I think absolutely you put a very, very important point here, that it's high time, every time it's been the women suffering, whether it's nutrition, and now vaccine is a very critical